Hello student, I am Dr. Priya Lakshmi, Associate Professor from Department of Public Health Dentistry, Vinayak Mission Sankaracharya Dental College. Today I will be presenting on mechanical plaque control, which is an essential component in the prevention of periodontal disease. Before going into detail into the today's content, let's see about the learning outcome. At the end of the session, the students will be able to define dental plaque and explain the need for mechanical plaque control, identify various mechanical plaque control aids, demonstrate the correct tooth brushing technique and interdental cleaning method. Introduction: dental plaque is a highly specific variable structural entity formed by the sequential colonization of microorganisms on the tooth surface, epithelium and restoration. Plaque control is removal of microbial plaque and prevention of its accumulation on teeth and adjacent gingival tissues. The main objectives of plaque control includes to reduce number of microorganisms on the tooth surface and prevent halitosis. Finally, it stimulates gingival massage. Mechanical plaque controls. There are various categories of mechanical plaque control aids. The first includes toothbrushes and dentrifiers. The second, interdental aids. Third, aids for gingival stimulation. The fourth, tongue scrapers. Let's look into the detail, each and every mechanical plaque controls in detail. Before going into the detail of toothbrushes, first we will see the history of toothbrushes. It was first introduced in China in 600 AD. Handles of gold, ivory or ebony were used. Nylon came into use in toothbrush construction in 1938. Various types of toothbrushes: manual toothbrushes, powered toothbrushes, sonic and ultrasonic toothbrushes and ionic toothbrushes. The main objectives of toothbrushing is to disturb and remove plaque, debris, food remnants and stains. It also stimulates and massage gingival tissue. So moving to the manual toothbrushes, the ideal requirements, it includes, it should conform to individual patient's requirement in size, shape and texture. It should be easily and effectively manipulated, and it should be readily cleaned and aerated, and it should be durable and inexpensive. So let's see the parts of toothbrush. The parts include head, handle, shank, tubs and brushing plane. So in the toothbrush, there are toothbrush bristles which are hard and soft, natural and synthetic, multi-tufted and space-tufted. The natural bristles are obtained from the hair of hog or wild boar, and it is tubular in form, and it will be more, but this natural toothbrush will be more susceptible to fraying, breaking and contamination with microbial debris, softening and loss of elasticity. Whereas the synthetic bristles, which is made from nylon, which will be uniform in size and elasticity, and it will be resistant to fracture. After seeing the nature of the bristles, let's see the stiffness of the bristles. It varies based on the following factors, like diameter of bristles, which is soft, which is around 0.007 inches, medium 0.012 inches and hard 0.014 inches. The length of bristles, inversely it will be proportional to stiffness. Number of filaments in a tuft, which includes nearly 80 to 86 bristles per tuft. The curvature of filaments are more flexible and less stiff. So according to ADA, American Dental Association specification of a toothbrush, the ideal toothbrush should be around 1 to 1.25 inches in length, or 5 by 16 to 3 by 8 inches in width, and it should have 2 to 4 rows of bristles and 5 to 12 tufts per row. Let's move to powered toothbrushes. The first powered toothbrush was developed in the year 1939, though Fredrik Thornberg in 1885, a Swedish watchmaker, developed mechanical toothbrush. The edges of the powered toothbrush oscillate in a side-to-side motion or in a rotatory motion. The indication for use of power toothbrush includes handicapped individuals, hospitalized patients, patients undergoing orthodontic treatment, individuals with limited manual dexterity, patients with prosthodontic or endosseous implants, patients on supportive periodontal therapy. Whereas the advantages, it increases patient motivations resulting in better patient compliance, increased accessibility in interproximal and lingual tooth surfaces, no specific tooth brushing technique will be required, uses less brushing force than manual toothbrushes, and brushing timer is incorporated in some of the power toothbrush. So let's move on to the sonic and the ultrasonic toothbrush. The sonic and ultrasonic toothbrushes produces high frequency vibration which leads to cavitation and acoustic microstreaming, which in turn that will help in stain removal and disruption of the bacterial cell wall. Whereas ionic toothbrushes change the surface charge of the toothbrush by an influx of positively charged ions that will in turn cause plaque with similar charge is repelled from tooth surfaces and attracted by negative charged bristles of toothbrush. So once after seeing into detail of all the various types of toothbrushes, before going into, there are various toothbrushing techniques which are available for different age categories. Let's see one by one. The first category includes the roll technique, the vibratory technique, the circular technique, the vertical technique, the horizontal technique, and physiological technique. The first and important, the most widely accepted brushing technique, which is the Bass method or sulcus cleaning method, which was developed in the year 1948. And this is one of the most widely accepted and most effective method. It is mainly indicated for all patients for dental plaque removal adjacent to and directly beneath the gingival margins. And it also indicated for for individuals who are having open interproximal areas, cervical areas beneath the height of contour of the enamel, and exposed tooth surface. In Bass technique, every tooth surfaces will be covered for the better oral hygiene maintenance. When it comes to the Bass technique, the main advantages includes the effective method for removing plaque adjacent to and directly beneath the gingival margins, cervical areas, and sulcus. It provides good gingival stimulation and it is easy to learn. Whereas disadvantages, this brushing technique may convert very short strokes that into a scrub brushing technique and causes injury to the gingival margin, and it is time consuming and dexterity requirement is too high for certain patients. Moving to the next brushing technique, the modified Bass technique, which is indicated for young adult patients. This combines both vibratory and circular movements. The bristles are placed 45 degrees to gingiva and brush handle is moved back and forth motion followed by sweeping over the sides of the teeth towards occlusal surfaces. Moving on to the next modified Stillman's technique. This technique is mainly indicated in patients who are with dental plaque removal from cervical areas below the height of contour of the enamel and from exposed proximal surfaces. It is recommended in areas with progressing gingival recession and root exposure. This technique, as it has been indicated, this technique covers the cervical areas below the height of contour of the enamel and the brush is placed in the 45-degree angulation. The disadvantages is time consuming and improper brushing can damage epithelial attachment. Moving on to the next technique, the Charter's method, which was developed in the year 1928. This technique is mainly indicated in individuals having open interdental space with missing papilla and exposed root surfaces. Those wearing FPD or orthodontic appliances will be indicated. For patients who had undergone periodontal surgery, this brushing technique will be indicated. The advantages of this brushing technique includes massage and stimulation for marginal and interdental gingiva. Whereas disadvantage, the brush ends do not engage the gingival sulcus to remove the subgingival bacterial accumulation. In some areas, the correct brush placement is limited or impossible. Digital dexterity are high. Moving on to the next method, the scrub method. This requires vigorous horizontal, vertical and circular motion. It is also called as free style of brushing. The main disadvantage of this method, it is ineffective at plaque removal and it results in the tooth abrasion and gingival recession to the individuals. Next technique is Phone's technique or the circular method. This is mainly indicated in young children with limited manual dexterity and children with physically or emotionally handicapped. The main advantage of this Phone's technique is easy to learn, short time. Disadvantages, trauma to gingiva, interdental areas are not properly cleaned. Moving on to the next technique, the vertical method. This technique includes the bristles are placed at 90-degree angulation to facial surfaces of the teeth with teeth edge to edge contact and brush in circular movement. The advantage, it is the most convenient technique and effective for small children with deciduous teeth. The disadvantage, the interdental spaces of the permanent teeth of the adults are not properly cleaned. The next technique, the roll technique, or it is also called as rolling stroke or ADA or the sweep method. This technique is mainly indicated in children and adult patients with limited dexterity. It is useful for preparatory instructions, that is as a first lesson for modified Stillman's technique. The disadvantages include brushing too high during initial placement can lacerate the alveolar mucosa, and this tendency to use quick sweeping strokes result in or no brushing for the cervical third of the tooth. Replacing the brush with filament tips directed into the gingiva may produce punctuate lesion. So let's move on to the next oral hygiene aids, the interdental cleaning aids. Factors, there are various factors in selection of an interdental cleaning aids. The first factor include type of gingival embrasures, alignment of teeth, fixed prosthesis or orthodontic appliances, open furcation area and based on the contact areas. As I told you in the various categories of the mechanical plaque control, along with the toothbrushes, the dentifrices have been included. These dentifrices, they aid in cleaning and polishing tooth surfaces, and this appears in forms of paste, powder and gel. There are various agents or composition has been used in the dentifrices. The agents used in the composition of dentifrices includes polishing or abrasive agents, binding or thickening agents, detergents or surfactants. These polishing agents, the material used is most commonly used is calcium carbonate, dicalcium phosphate dihydrate, alumina or silica. This aids in eliminating plaque and remove stains from the tooth surface. Whereas binding agents includes alginates, sodium carboxymethyl cellulose and magnesium aluminum silicate. These agents control stability and consistency of a toothpaste. The surfactants, the material used, most common material used is sodium lauryl sulfate. This produces the foam which aids in the removal of food debris and also dispersion of the product within the mouth. There are other compositions like humectants. The material used is sorbitol, glycerin. This aids in reducing the loss of moisture from the toothpaste. The flavoring agents like peppermint oil, spearmint oil, they render the product pleasant to use and leaves a fresh taste in the mouth after use. The sweetening and the coloring agents, the material used is saccharin, which is mainly used as a sweetener. There are other agents like antibacterial agents, triclosan, the most commonly material used, anti-caries agents like sodium monofluorophosphate, sodium fluoride and stannous fluoride will be included. Other composition like anti-calculus agents like pyrophosphates, zinc citrate, zinc chloride. This aids in functions. The most anti-calculus agents are mostly designed to inhibit the mineralization of the plaque. They are also known as crystal growth inhibitors, whereas the desensitizing agents, the material used is sodium fluoride, potassium nitrate and strontium chloride. As we have covered the toothbrushes, toothpaste, and moving on to the next content is the interdental cleaning aids. In this interdental aids, the most commonly used is the interdental brushes. The first, it was introduced in the year 1960. These interdental brushes effective in plaque removal from proximal tooth surface, and it is recommended ideally for periodontitis patients. As I told, is mainly indicated for proximal tooth surfaces, orthodontic appliances, fixed prosthesis, periodontal splints. There are various types of interdental brushes. We will look into the single tufted brush, which has smaller brush heads. The tuft includes 3 to 6 millimeter diameter. The handle is straight or contra-angled. Angulated handles are more easier to access. Palatal and lingual surfaces. Filaments are directed into the required area and activated with rotation motion. Their design permits access to even tipped, rotated or displaced tooth and effectively cleans fixed dentures and orthodontic appliances. The next interdental cleaning aids is the dental floss. There are various forms of dental floss. It includes multifilament. It can be either twisted or non-twisted, bonded or non-bonded, thick or thin, waxed or non-waxed. The main functions of dental floss include removal of adherent plaque and food debris from the interproximal areas, polishing of the tooth surfaces, stimulating and massaging the interdental papilla. This helps in locating the following subgingival calculus deposits, overhanging margins of the restoration, proximal caries lesion. The vehicle for application of polishing or therapeutic agents. It acts as a vehicle for application of polishing or therapeutic agents. Lewis Pierre Palmley, a dentist from New Orleans, who is the inventor of modern dental floss. There are two methods for dental flossing. First, we will look into the spool method or finger wrap method. This method includes 12 to 18 inches long floss is taken. About 4 inches from each end is wound around middle finger of each hand. Whereas the next method, circle or the loop method for dental flossing. In this method, first step is to make a small loop around the tip of the forefinger. Pass the end of the floss through the loop. Make a knot. Use the thumb and forefingers of both the hands to hold the floss. Use saw motion to slide into the interdental space. Wrap around one teeth, make C shape, gently pull down to the deepest part of the gingival sulcus, slide it up and down. Moving to next interdental aids, the wooden tips. It is mainly indicated in type 2 gingival embrasures. It is mainly manufactured from orange wood under triangle in cross section. The irrigation devices, the water pick, it is mainly beneficial in the removal of unattached plaque and debris, and it may also be used to deliver antimicrobial agents subgingivally. The drawbacks of this irrigation devices, expensive and transient bacteremia, that it results in inflammation. The next interdental aids include gingival massage. It improvises the keratinization, blood flow, increased flow of GCF within the gingival sulcus, and overall improvement that will result into the overall improvement in the gingival health. To conclude, mechanical plaque control is the primary and most effective method for preventing dental caries and periodontal diseases by regularly disrupting dental biofilm. Proper tooth brushing and interdental cleaning significantly reduce plaque accumulation and gingival inflammation. Its long-term success depends on correct technique, patient motivation and regular professional guidance. Thank you.